Every second man over 60 has prostate problems, but here is what makes me angry. Your urologist is not telling you something important. For 15 years, I have been watching men destroy their prostate. They drink water, they exercise, they take supplements, and their prostate keeps growing. Why? Because timing matters more than the action itself. You can do everything right at the wrong time and get zero results. I am going to show you the 5 habits that actually work with exact timing and exact protocol. No pills, no surgeries, just 5 things. The third habit will shock you because you have been doing it wrong your whole life. Let me tell you what happens to your prostate after 60. Every year it grows 1%. Does not sound scary, right? Wrong. In 10 years, your prostate doubles in size. It doubles and starts squeezing your bladder like a fist. First, you get up once at night, then twice, then 4 times, then you stop sleeping normally at all. Your wife moves to another room. You are exhausted. Your sex life? Forget about it. And you know what most men tell me? They say it is normal, just part of getting older. No, it is not normal. You know what is normal? Sleeping through the night at any age, having sex at 70, peeing without waiting 2 minutes for the stream to start. That is normal. But here is the problem. 90% of men do exactly what I said in the beginning. They drink water, they exercise, they take supplements, and nothing changes. Why? Because they do it at the wrong time, in the wrong way, with the wrong protocol. I have seen hundreds of men over 60. Some keep their prostate healthy until 80. Some end up with catheters at 65. The difference? 5 daily habits done right at the right time. And I am going to show you each one, starting with the most unexpected. Habit number 1 is water. You drink water every day, right? You think you are doing everything correct. Wrong. Most men over 60 drink water like they are 30, and that is a big mistake. Here is what happens. You drink 2 liters of water throughout the day. Sounds healthy, right? But then you drink a glass at 7 p.m., another one at 9 p.m., you go to bed at 11, and at 2 a.m. you wake up with your bladder full. You stumble to the bathroom half asleep. This happens every night, and you think it is your prostate. No, it is your water schedule. Listen carefully. After 60, your bladder does not hold as much as before. Your prostate is bigger and pushes on the bladder, so your bladder capacity drops from 500 milliliters to 300. Now add water before bed, and you are basically guaranteeing yourself night trips. Here is the protocol that works. 1.5 liters of water per day. Sounds like not enough? It is enough. Trust me. But here's the key. 90% of this water before 6 p.m. Write this down. In the morning, 500 milliliters right after you wake up. On lunch, 500 milliliters with food or right after. In the afternoon, 400 milliliters before 5 p.m. and evening after 100 milliliters maximum. That is it. I had a patient named Robert, 62 years old. He woke up 4 times every night for 2 years. Tried pills, tried supplements, nothing worked. I asked him one question. What do you drink after dinner? He said water, tea, sometimes juice. About 3 glasses total. I gave him this protocol. 30 days later, he called me, sleeping through the night for the first time in 2 years. He did not change anything else, just water timing. Now here is what you should not drink after 6 p.m. Coffee, obviously. Tea, even green tea. Alcohol is a big no. Juice has too much sugar plus liquid. Soda? Are you kidding me? Only water and only 100 milliliters. If you are thirsty, rinse your mouth. Do not drink a full glass. This is habit number 1. Simple, free, works in 7 days. But if you mess up habit number 2, this will not help, because habit number 2 is about movement, and 90% of men move wrong after 60. They think walking is enough. It is not. Let me show you what actually works. Habit number 2 is movement. You walk every day, right? 10,000 steps. You feel great about yourself. I have bad news. Walking does not help your prostate at all. Let me explain. When you walk, blood flows to your legs, to your heart, to your lungs, but not to your pelvis, not where your prostate is. Your prostate sits deep in your pelvis, surrounded by muscles. When you just walk, those muscles stay tight and blood flow is minimal. So your prostate is basically sitting there not getting enough oxygen. not getting enough nutrients, slowly getting worse, and you think your daily walk is helping. It is not. Here is what actually works. Pelvic floor exercises. You probably heard about them. Kegel exercises. And you probably think they are for women. Wrong. For 15 years, I have been prescribing them to men over 60, and they work better than any supplement on the market. But here is the problem. 90% of men do them wrong. They squeeze the wrong muscles, they hold for the wrong time, they give up after 3 days because they do not see results. So let me give you the exact protocol. Sit down or lie down, does not matter. Now squeeze the muscles like you are trying to stop peeing midstream. Feel it? Good. Now squeeze and hold for 5 seconds. Release and rest for 5 seconds. Repeat. That is 1 rep. You need 15 reps 3 times per day. Morning, afternoon, evening. 5 minutes total per day. That is it. But you have to do it every day. Not when you remember, not when you feel like it. Every single day. I had a patient named James, 67 years old. His prostate was the size of a tennis ball. He could not pee normally. Weak stream pain. He started doing these exercises every morning right after coffee. Set a timer on his phone. 5 minutes. 60 days later, he came back. His prostate shrunk by 30%. Stream normal, pain gone. He did not take any pills, just 5 minutes of exercises every day. Now here is what most men do wrong. They squeeze too hard. You do not need to squeeze like your life depends on it. Gentle pressure for 5 seconds is enough. Or they hold their breath. Do not hold your breath. Breathe normally in and out. Or they do it lying in bed at night and fall asleep after 3 reps. No. Do it sitting up, alert, focused. This is not a relaxation exercise. This is work. And one more thing. If you have acute prostatitis right now, if you have pain when you squeeze, stop and go see a doctor first. These exercises are for prevention and maintenance, not for treating active infection. Got it? So habit number 1 is water timing. Habit number 2 is pelvic exercises. Both are free. Both work in 30 to 60 days. But if you mess up habit number 3, you can forget about results, because this is where it gets controversial. Everyone tells you it is healthy. Everyone tells you to eat more of it. But for your prostate after 60, it can be poison, depending on when you eat it. Let me show you what I mean. Habit number 3 is food, and this one pisses me off the most because everyone is lying to you. Doctors, nutritionists, Instagram fitness gurus, they all say the same thing. Eat more protein, drink more milk, dairy is healthy. For your muscles? Sure. For your bones? Maybe. For your prostate after 60? Disaster. Let me explain what actually happens. Dairy contains something called IGF-1, insulin-like growth factor. Sounds scientific, right? Here's what it does. It makes cells grow. When you are 20, that is great. Your muscles grow, your bones grow. When you are 60, your prostate grows too, and you do not want that. Studies show men who eat dairy every day have 40% higher risk of enlarged prostate. 40%. But here is what nobody tells you. I am not saying cut dairy completely. I am saying timing is everything. Cheese for breakfast? Fine. Your body burns it during the day. Glass of milk at 9 p.m.? You just fed your prostate growth hormone for 8 hours straight while you sleep. Smart? Not really. Here is the protocol. Dairy only before 2 p.m. Write this down. Morning coffee with milk? Okay. Cheese sandwich for lunch? Fine. Yogurt at 3 p.m.? Last call. Milk before bed? Forget it. After 2 p.m., 0 dairy. Now let me tell you what you should eat instead. 3 foods that actually shrink prostate inflammation. Number 1, tomatoes, but cooked, not raw. When you cook tomatoes, they release lycopene. Lycopene is like medicine for your prostate. Tomato sauce, roasted tomatoes, tomato soup. For times per week minimum. Number 2, pumpkin seeds. 1 handful per day. They contain zinc, and your prostate loves zinc. Raw or roasted, does not matter, just chew them well. Number 3, green tea. But here is the trick. Not in the morning with breakfast, between meals. 10 a.m., 3 p.m. Let it steep for 5 minutes and drink it hot. 2 cups per day. I had a patient named Michael, 64 years old. His prostate was like a small orange. PSA levels through the roof. He was drinking milk every night before bed for 30 years. Thought it helped him sleep. I told him to stop. Cut all dairy after 2 p.m. Added tomatoes, pumpkin seeds, green tea. 90 days later, he came back for tests. Prostate shrunk by 25%. PSA dropped from 8 to 4. He looked at me and said, "That is it? Just food timing?" Yes, just food timing. No pills, no surgery, just eating the right things at the right time. So let me recap habit number 3. No dairy after 2 p.m. Tomatoes 4 times per week. Pumpkin seeds daily. Green tea between meals. Simple, cheap, works. But you know what ruins all of this? Sleep. Specifically how you sleep. Because 90% of men over 60 sleep in the worst possible position for their prostate, and they do it every single night for 8 hours, putting constant pressure on the gland. I am going to show you exactly what position is killing your prostate and what position actually helps it. This one shocked me when I first learned it. Habit number 4 is sleep position, and this one is going to surprise you. Because 90% of men sleep on their stomach. Feels comfortable, right? Wrong. You are crushing your prostate every single night. Let me explain what happens. When you sleep on your stomach, your pelvis presses into the mattress. All your body weight for 8 hours. Your prostate sits right there in your pelvis, already enlarged, already inflamed, and now you are putting 70 to 90 kilograms of pressure on it for 8 hours straight. Smart? Not even close. That is why you wake up and need to pee immediately. That is why you have pain in the morning. That is why your symptoms are worse after sleep. You literally spent the night squeezing your prostate like a sponge. Here is what you should do instead. Sleep on your side, left side or right side, does not matter. Put a pillow between your knees. This keeps your pelvis aligned with no pressure on the prostate. Or sleep on your back with a small pillow under your knees. This takes pressure off your lower back and pelvis. These 2 positions, that is it. No stomach sleeping ever. I know it is hard to change. You have been sleeping on your stomach for 40 years. But here is the thing. You can get used to a new position in 2 weeks, maybe 3. Your prostate cannot get used to being crushed every night. I had a patient named William, 69 years old. He woke up in pain every morning and needed to pee 3 times every night. I asked him how he sleeps. Stomach, always. I told him to switch to side sleeping. He said he cannot fall asleep on his side. I said try for 1 week, just 1 week. He came back 3 weeks later, sleeping on his side now. Pain gone, night trips cut in half. He told me he should have done this years ago. Yes, you should have. So starting tonight, no more stomach sleeping. Side or back, pillow between knees or under knees. Your prostate will thank you in the morning. Now we covered 4 habits. Water timing, pelvic exercises, food timing, sleep position. All of them are free. All of them work. But habit number 5? This is the game changer. This is what separates men who stay healthy at 80 from men who end up with catheters at 65. And it is so simple that most men laugh when I tell them. Then they try it and they stop laughing because it works better than any pill I can prescribe. Let me show you what I am talking about. Habit number 5 is the game changer, and I am not joking when I say most men laugh at this. They sit in my office, I tell them, they look at me, they laugh. Then they ask if I am serious. Yes, I am dead serious. Here it is. Ejaculation. Regular ejaculation. I can see you smiling right now, but let me explain the science before you close this video. Your prostate produces fluid every day, all the time. When that fluid sits in your prostate for weeks, it becomes stagnant, like water in a pond. Bacteria grows, inflammation starts, your prostate swells. Now imagine you flush that fluid out regularly 2 to 3 times per week. Fresh fluid comes in, old fluid goes out. Your prostate stays clean and stays healthy. Studies show men who ejaculate 21 times per month have 60% lower risk of prostate cancer. 60%. That is better than any supplement, better than any medication I can prescribe, and it is free. Now I am not saying you need a partner for this. You are 60 years old. You know what I am talking about. Partner? Great. Solo? Also great. 2 to 3 times per week minimum. But here is what most men get wrong. They think more is better. Every day, multiple times per day. No. After 60, your body needs recovery time. 2 to 3 times per week is optimal. More than that, and you are just exhausting yourself. I had a patient named Richard, 66 years old. Chronic prostatitis for 3 years. Tried antibiotics, tried supplements, nothing worked. I asked him about his sex life. He said he is married 30 years, maybe once a month. Once a month, his prostate fluid sitting there for weeks at a time. I told him you need to change this, 2 to 3 times per week. He looked uncomfortable, then his wife looked at him, then they both started laughing. 90 days later, he came back. Pain gone, inflammation down, PSA normal. He shook my hand and said best prescription ever. So habit number 5 is ejaculation, 2 to 3 times per week. Sex, masturbation, does not matter. Just keep that prostate flushed. Now let me put all 5 habits together for you. Habit 1, water timing, 90% before 6 p.m. Habit 2, pelvic exercises, 15 reps 3 times per day, 5 minutes total. Habit 3, food timing, no dairy after 2 p.m. Tomatoes, pumpkin seeds, green tea. Habit 4, sleep position, side or back, never stomach. Habit 5, regular ejaculation, 2 to 3 times per week. All 5 habits together work like a protocol. You do 1 or 2 and you will see some improvement. You do all 5 and your prostate will stay healthy for decades. No pills, no surgery, no expensive treatments. Just 5 simple habits every day for the rest of your life. Is it easy? No. Changing habits is never easy, especially when you are 60 or 70. But you know what is harder? Waking up 5 times every night, having a catheter, prostate surgery. Your choice. Start with habit number 1 tomorrow morning, water timing. Then add habit number 2 next week, pelvic exercises. Build the protocol step by step. Do not try to do everything at once. Give yourself 90 days, 3 months. After 90 days, check your symptoms. Night trips, stream strength, pain levels. I guarantee you will see improvement. And if you want to learn more about prostate health, subscribe to this channel. I post new videos every week. Next video, I am going to talk about the 5 worst mistakes men make when treating prostatitis. Mistakes that make everything worse. You do not want to miss that one. Link in the description. Take care of your prostate. It is the only one you have got.